This conference will now be recorded.
A very good evening to everyone present here. We, House Surgeons Association 2021-22, Government Ayurveda College Trivandrum, welcome you to the first session of our academic series, VEEKSHA. We are extremely grateful for your humble presence. We have with us Dr. Anand S. Dr. Anand S. did his UG and PG in Government Ayurveda College Trivandrum. He has got a fellowship from the University of Transdisciplinary Health Sciences and Technology, TDU, Bangalore. He has been a part of many national and international seminars. Sir has also presented papers on nanoparticles here. His PhD study is based on action of rasa oushadis on cancer. He takes regular webinars with Rasaratna Samushaya series at Rasa Darshana in association with Ayurvedic Medical Association of India. His innovative attempt on producing masks impregnated with herbal extracts with the name Ayur masks has gained much recognition and accolades. With utmost pride, I welcome Dr. Anand S. Before we start
Thank
the
you,
session,
Dr.
I
T.
call. Thank you, sir. Before we start the
Thank
session,
you for this introduction.
thank you, sir. I call upon Sina for the prayer.
रागादिरोगान् सददानशक्तान् अशेषकाय प्रसृतानशेषान् औत्सुक्यमोहा रदितान् जगाना यो पूर्ववैद्याय नमोऽस्तु तस्मै.
Without much delay, we are going to start the session. All are requested to post your queries on the chat box. The questions will be answered by Sir at the end of the session. Over to you, Sir.
Okay. Thank you very much. And I congratulate the organizers, the House Students Association of Government Ayurveda College Trivandrum, in organizing these programs of great academic interest and to develop the clinical skills. And good evening to everybody. Let us start the session directly. And let me share my screen. Can you see the screen?
Yes, sir.
Okay. So, with the introduction, I wish to communicate with you that even though a lot of medicines are there, a lot of choices are there, but we have to make an intelligent choice that by judging the condition of the patient as well as the condition of the disease. That's very important. Judging the condition of the patient and using your intellect and logic. If you select the medicine with the specific results could be achieved, that is the key to success. What I'm saying is that there are a lot of mangas and a lot of formulations, a lot of resources, and many of the times Ayurveda is rich with a lot of options, but you are confused. That's the major problem which I can uh, communicate to you. So you should have a clear understanding how to use these medicines in a right way, using your logic, using your judgment. Let us start. Our aim is to apply rasa to meet the current health issues and exploring the rasayanas. Why I have used this rasayanas? The term rasayana is rasadina mayana rasayana. So it optimizes the use of rasayanas, optimizes the function of all the dhadus, makes perfect health. Actually, these rasa are the rasayana drugs which can act at the subtle level by virtue of its sukshma property. And there is a need for a revitalization of rasa chikitsa. So what I mean is that if you clearly understand the pathology, then only you can select the correct medicine. If you know, if you have already seen that lot of indications for jara, for example, for jara as indication, you can have lot of medicine. So coming to a patient, how you select a yoga, that is very important. So by understanding the pathogenesis of what is happening in the patient, then we can choose the right medicine, the specific medicine. So implementing suitable treatment protocol is needed. So you can see even in Jara, for the instant, the base of all the pathology is Jara. Jara Adhyaya, we can see the base for all pathology, including the COVID situation, COVID, novel coronavirus disease. We can find the etiology, the Jara etiology. And there are a lot of joys. Some of them are listed. The popular ones are listed. You can make a Sahasra Yoga with indication, resolution is indicated for Jara. But the choice, how to pick the right one for the right person is what is needed and make promising results. That is the key to success. You can see Vettumaran Guliga, Surya Prabha Guliga, Ananda Bhairava Rasa, Hinguleshwara Rasa, Arogya Vardhini Rasa. These are all have indications for Jara. So how will you use it? Whether you, if Vettumaran is not available in your clinic, you give Surya Prabha or Arogya Vardhini. At what condition of Jara you give Arogya Vardhini? Can anybody have an idea? You can also interact. I am not questioning, but if you have, if you are, if there is an interactive mode, the session will be more useful. That's why. So if you have any idea, you can reply. So a lot of choices are there. So in which stage you use Vettamaran, in which stage you use Surya Prabha, even in Jara. Jara is a broad spectrum. So of that spectrum, in which area specifically you use Vettamaran, you use Arogyavardhani, or what is the relevance of Surya Prabha in Jara Chikitsa, in a Jara patient? Can anybody have an idea, or you can casually you can say no problem. Whether it is right or wrong, it's not problem. If anybody have an idea, please unmute and say what is the what is your reason for selecting one resolution among these? These are the popular one. Other than this, lot of resolutions. So by knowing its indication is not a way to treat the patient. So we should judge in which condition you use. So I'm mentioning about its differential use. Like a differential diagnosis, differential use is very important for success. So if you select it aptly, you will get results within no time. Very quick results you can achieve if you select the right one. So anybody can reply about this. How will you differentiate this? Even though all these have indications in Jara. Can anybody have idea? You can unmute and please respond. Anybody? You can have a casual answering, no problem. Just for a communication, I am. Uh,
I think according to the types of jara, sir.
yeah, but we should be more specific. So, okay, you can say.
Sir, Vetumaran will be the choice. The temperature rises above 100. In that case, when there is shivering, in such cases, Vetumaran will be the best choice. And Ananda Bhairava, I think, sir, when Ama is more involved, when we need Deepana Pajana, in that case, Ananda Bhairava Rasam will be the choice.
That's a good answer, but we need to have specific specifications. That's a good answer. But the point is that when the whole Jara Pragarna, if you judge the whole Pragarna of Jara, the practical point which we get is two things, two type of we can differentiate the Jara into two parts. One is the period of inflammation, the stage of inflammation. For every disease, there is a stage of inflammation. So at that stage, what medicine you use, that you should choose. And the next, after the stage of inflammation, the patient will have another phase which will affect his dhadus, that is dhadu leenavastha. So the patient will be tired and his dhadus will be affected and he is not well and many other problems will come into play. So the stage of inflammation which we call as amavastha and the other stage which dhadu leenavastha. So this is the major thing, the two component which we can separate in Jara. For every person, which any patient approaching you is having either inflammatory stage or is having a dhatu leenavastha. So among this, the Vettamaran Guliga, Suryaprabha Guliga, Ananda Bhairava Rasa, Hinguleshwara Rasa, these are all fit for the inflammatory stage, the first stage of Jara, which has the signs and symptoms of inflammation in him. You can judge, you can see the signs of inflammation in the patient. At that instance, you can use these oushadis, starting from Vettamaran, as the reply itself is revealing that Vettamaran, the name itself is revealing the relevance of Vettamaran Guliga. Vettu, when you repeat the term Vettamaran, Vettamaran, Vettamaran means it will prevent seizures. So the formulation is capable to prevent the seizure, which is in a patient when the patient's brain is affected, the seizures come. So at that critical point also, the formulation is useful. That is indicative from the name itself. And it contains pingula and valsanabi. These are the two major drugs which are very excellent for inflammation. Valsanabha and hingula are the best drugs which can pacify inflammation. So in every inflammatory stage, this will work. That's the reason why many of the majority of the formulations contain, for Jara contain Valsanabi or hingula. So that are the major components in that formulation. And along with that, many Shodhana drugs, and also we can see some antidotes like Tangana is also in the combination so that there will be no harm effect for the patient. So If the Vectomaran Guliga is properly prepared, it is indicated even for febrile seizures in which the patient is brain is affected and the fits are happening. When I have given one of the patient the Vectomaran Guliga in a seizure condition, we can see that it is observed that the patient's seizure has come to ceased. Within 5 minutes, the patient recovered and the seizures doesn't doesn't recur. So that's the importance of the Vectomaran Guliga. Even in the inflammatory stage, this is more specific to reduce the temperature of the patient, which can affect his brain. Then the Surya Prabha Guliga. So looking into the indication of Surya Prabha Guliga, we can see that Kasa Swasahari Mahajurahari Namnatu Surya Prabha. It is indication Kasa Swasahari Mahajurahari Namnatu Surya Prabha. So what I am pointing out is that, stressing is that, even if you have in your clinic you have a choice for Vectomaran Guliga, there is out of stock. Then you take another medicine which is indicative for given. That's not the way to determine and judge the and how to select the medicine. That's not the way. And we have to judge at that what stage the medicine should be incorporated. So Surya Prabha, Kasa Swasahari Mahajurahari Namnatu Surya Prabha. So if a person coming with fever along with chest infection, the best choice is Surya Prabha Guliga than Vectomaran Guliga. So what I am stressing is that you should be very specific in selecting the combination, in selecting the formulation. Kasa Swasahari Mahajurahari Namnatu Surya Prabha. So it will work more specifically in a patient having fever with a chest infection, with a sputum, with cough, with chest infection. All these fever, those patients have very good effect if we select the Surya Prabha Guliga. And another reason for that, it is more Srodoshodana also. The Surya Prabha Guliga doesn't contain hingula. Instead, it contains this kajali. Kajali is more penetrating. It can have more penetrating effect, and it is more Srodoshodana. So even not only in that infectious stages of chest, but for many other infections, including tonsillitis, including laryngitis, all these, Surya Prabha is the best choice along with Amrutharishta. If any upper respiratory tract infection is prevailing in a patient, if you select Surya Prabha Guliga along with Amrutharishta, it is the best one, and with a localized treatment is also needed as a gargle or a throat pain with Tangana. Tangana Madhu is for the application as a throat paint or as a gargle, so that the inflammation will be relieved within hours. So it works much more than an antibiotic work. That's the strength of our system. Then coming to Hinguleshwar Rasa, there is only three components in Hinguleshwar Rasa. What is that? One is Valsanabha, one is Pipali, and another one is Hingula. Only three. And these are very good when it can be replaced for paracetamol. Paracetamol is a hepatotoxic drug, but Hinguleshwar Rasa is also liver protective. Since it contains Pipali, it is a liver protective. So this can be used, but these are used to reduce the inflammation persisting in the patient, not as a antipyretical. They have antipyretic property. Hingula, Valsanabha also have antipyretic, but more than that, it subsides the inflammation, which is the main thing in Jara. So the main feature of Jara, even if it is Santaba outside, the temperature is rising. The main pathology you can see is the inflammation. Shobha is the main thing persisting in Jara. So you need to address the Shobha. The patient's body try to keep cope up with that, the inflammatory state by virtue of sweating, by virtue of vamana, by chardi and bahumutrada, the body tries to cope up the situation. So we have to support the body. Baladhishtanam arogya, arogyartha kriya. So by doing this, by giving this formulation, we are supporting the body to get rid of the inflammation, and the patient will slowly come back to the normal stage. But at the same time, you can look at the Arogya Vardhani Rasa. That is another choice in Jwara. So, but Arogya Vardhani, as it contains Kirada Tikta, the majority of the ingredient, 50% of the ingredient is Kirada Tikta. So, it is best for Dhadu Gada Jara. So, the second part of the Jara, if a person comes to as a Dhadu Leena Avastha, in which it will be affected, the liver will be affected in a Leena Avastha, mostly, and his Dhadus will be affected. At that instance, the specific choice is not Vetamaran or not Surya Prabha. The best choice is Arogya Vardhani. For example, if you give, for example, in the case of a dengue hemorrhagic fever, the liver is affected, the rasa rakta dhadus are affected, so it is dhadulina avastha. You can see dhadulina avastha in that. So the choice there is Arogya Vardhani Rasa rather than Vitamaran Guli. So what is my point? My point is that you have to select the medicine. You have to select the medicine according to the stage of the patient. Even though a lot of indications, lot of formulations are there, hundreds of choices are there, you can get into the result only by the specific use of the medicine. The differential use is very much important. So now we can list, you can see that even the Jora, many of the sub things you can see, Adanduga Joja is there, Adanduga Jora. Some external factors are contributing to even the coronavirus is an external one, Adanduja, but it becomes Nija later. So Sanjeevani Vadi is the best one, which contains Valsanabha and Balladaga, and it is Bhavana. The Bhavana is done in Gomutra. So it is highly Srodoshodana and highly Vishahara. So in many of the cases, many of the traumatic cases, many of the poisonous cases, even in food poisoning can be used. Sanjeevani Vadi, the best one, and you will get excellent result within short time. Even we use the Modi Guriga likewise, but we will get more result, more quick response by using Sanjeevani Vadi, as it contains sharp rasa drugs like the like Valsamaba and this Balladaga and Gomutra. So many conditions we have already discussed, the Vetamar and Guliga. But in many of the patients, the patient is having gastritis. How can you give the medicine with Amrudarishta? So you can use another medium. The medium is also very important by administering. So in Vetamar and Guliga, if a patient is having gastritis, you can't use its anapana as ginger juice. Many of the time you can use ginger juice. But if the patient is having gastritis, how can you give? He will vomit again. So you can use this Palandu instead of that, Palandu Sarasa instead of that. So likewise, you have to logically design the administration of the drug. To select the drug rightly, and to incorporate with Anubana, right Anubana, according to the stage of the patient. Then Tribhuwana Kirti Rasa is also very useful in almost all jaras, and all the viral fevers it can be useful. Then Vishada Jara, in many of the climatic conditions, when the rain comes suddenly, the Vishada Jara occurs due to the presence of Amlatva in the Jala. The Amlatva will increase and it will disturb, it will bring disturbance in our metabolism and it will create Jara. As the rain comes, we can see an outburst of viral fevers. In that, the best one is Surya Prabha, which you can use in Amrita or in Sudarsana. And the Vishama Jaras we have discussed, Arogyavardhani is the right choice. Pikta, the Pikta is the majority one, along with the Rasayana drugs like Abraga, Loha, etc. This Arogyavardhani is a good choice for Vishama Jara. And in Sannipada Jara, in which many critical care is needed, the Mrityunjaya Rasam, we have such choices like Mrityunjaya Rasam, and in Purna Matra you can use, even in ICU, we can use some of the medicines like Mrityunjaya Rasa. And what I have mentioned is that we have a range of products starting from the small one to higher ones, higher grade medicines. So you can see in Jurna Jara, the Lakshmi Vilasa Rasa, which contains gold. Why it is selected? The patient will be having less bala. So the Suvarna, like Brahmana, drugs like Suvarna is needed to bring back his health. Even if Lakshmi Vilasa Rasa is not available, you can use this Siddhama Raja to increase the bala of the patient. The bala of the patient is very much important for the response, since all our treatment modalities work, only the patient has enough bala. So if the patient is weak, do increase the bala of the patient. For that, these are very much important. These formulations are important for increasing the bala of the patient. So the Sannipada, you can see Jayamangala Rasa. So the specific use of Jayamangala Rasa, which consists of even Gauri Pashana. This Jayamangala Rasa is very much specific in use in pneumonia, the fevers and the complications with the pneumonia. A patient with COVID-19 in ICU is admitted in ICU, and by the use of Jayamangala Rasa, he responded well. The oxygen saturation went up, and he was able to bring back to the room within the 24 hours. So this Jayamangala Rasa, you can see in pneumonia patient, the crepitus which can be observed in pneumonia will be vanished within 14 days by the use of Jayamangala Rasa. So it is a very confident drug which you can use in pneumonia, but the dose you should be very careful. Only half rati, 65 milligrams is needed, and for emergency or critical purpose, 2 doses of that, 65 milligram into 2 can be given. That's all. But Vettumaran, Suryaprabha, all those can be given in up to 2 rati. It can be given. 2 rati means up to 250 milligram, and 2 doses of that for 2 or 3 days is also not going to make any problem. It is okay to have that dose. Then Swarnamalini Vasanta Rasa is also for Jirna Jara, which the patient is very much affected with bala. He is loss of the bala. Now these are the formulations which are we discussed. We have discussed that. And now coming to the next context, Rekta Pitta. So we can see in Jara the inflammation inside. We should treat it well. We should address it well. In the whole Jara Adhyaya, we can comprehend into 2. First one is the state of inflammation, and the next is the Dhatu Leena in which the patient's dhadus are affected. So we have 2 strategies for that. For dividing the inflammation is the first one, and then to stabilize the dhadus. For that, we can differentially use the formulations which are said in Jara Chikitsa. So, have you diagnosed rectabittam? Any cases of rectabittam? If anybody have diagnosed, especially the house surgeons, I'm asking about from the in the house surgeons. Anybody are you familiar with the rectapitta? Any patient with rectapitta you have seen? You can respond yes or no, or are you able to diagnose it? Rectapitta, you have studied it, or you are confident enough to diagnose the rectapitta? Anybody? So we can discuss two or three major things in rectapitta. The thing is that, yeah, the thing is that rectapitta is a bleeding disorder. As we know, all of us know rectapitta is a bleeding disorder. So why? What is the relevance of it? Is any bleed can be considered as rectapitta, or any peculiar type of bleeding disorders can be considered as rectapitta? Not all bleeding disorders are rectapitta. So how will you differentiate a bleeding and how will you diagnose that as rectapitta? Can anybody have an idea? So let us see the Samprapti in Ashtanga Hridaya. The last line you can see Prabhati Asrujaha Sthanat Plihado Yagridaschatat. Plihado Yagridaschatat. So Pliha and Yagrid are affected. In those bleeding disorders in which the pliha and the yagrit are affected can be considered and we can apply the treatment of rectapitta. That's the thing. So pliha do yagrita. So in the Sambrapti Ghadaga, for a bleeding disorder, the liver and spleen is affected in the pathology, then it can be considered as a rectapitta. So that is, so this idea should be there. So unless the rectapitta, one of the best drug, the rasa oushadis, which can be useful in rectapitta is Kasisabasma. It's an excellent medicine which works well in rectapitta. But you should know which person has rectapitta. Otherwise, how will you apply? So this is the thing. The third line, you can see the plihado agrasya. So the spleen, you can see the splenic enlargement in the patient. So if you palpate the, it is palpable. The liver and spleen will be palpable. The platelets will be very low in those patients with bleeding. So in many of the cases, like idiopathic thrombocytic purpura and things like that, you can have treatment. The excellent choice is Kasisabasma. Annabedi Sindura. Kasisa is otherwise Annabedi Sindura. Let us come to that. So some of the cases which are not this Drakshadi Kashaya is a best anabana for Annabedi Sindura. So what I'm saying is that, what I'm explaining is that, so there is a problem with the liver and the spleen in that pathology. Samprapti Ghadaga is there. So Susruta has said how recta is formed. So yagrit plihana prapya saragam ubayudi. So the transformation, the formation of blood is affected. So any pathology in which the hemopiesis is affected, then you can diagnose it as a rectapitta and give the treatment. And the best result should be for rectapitta, which you can guarantee the result is the Kasisabasma. 100 milligram Kasisabasma is a choice of treatment. So what is the anubana, best anubana for that? So you can see once the liver and the spleen is affected, the hemopiesis got affected. So in which part? The recta dhatu has 5 major things Visrada, Dravada, Lekuda, Raga Spandanam, Bhumyadinam Drishyande Atra Shonudai. So this is a balance of 5 factors, and you can see the Dravada is increasing here in Raktabhitam, and if you know, it is a logical thing. In many of the patients, you can see only a capillary bleed, not an outflow of bleeding from major artery. It's only a capillary bleed. So what might be that? It might be it is the process of what now it is an osmosis. For inside the blood vessel, inside the wall, the blood gets loosened, the thickness is loosened, and outside there are extracellular fluids, the tissue fluids, and they are separated with a blood vessel. And that is a blood vessel. The wall of the blood vessel is nothing but it is a semi-permeable membrane. And in chemistry, you have studied that is called the that is nothing but that is called osmosis. So it happens and the bleeding occurs. So the prognosis is that urdham sadhyam kabat. So the urdhva raktabhitara sadhya, and many of the patients with bleeding from nostrils and gum bleeding, we could arrest them, we could manage them with causes of asthma. It's an excellent choice. So the best choice of Manipana here is nothing but the Agraushada for Rektabita. That is what is the best one? The Vasha Sarasa. You can give in Vasha Sarasa. So you can give Sahapana of Vasha Gulujya Grashaya, and if the patient is having tiredness, lethargy, most of the time persists, and Drakshadi is also a choice. And Rektabita is also indicated in Drakshadi Kashaya. So along with that, you can use Arogya Vardhani Rasa as a combination. So in those patients with having this bleeding pathology, with the liver and spleen affected, many of the patients will be coming to you, and we can manage by this protocol of Rektabita, and the best one Rasa Oushadi for that is Kasisadasma, and the best Anudana is the Vasha Rasa, and the best Sahabana is Drakshadi Gashaya, and Drakshadi Gashaya as well as Vasha Guluchadi Gashaya. More than that, to bring back the equilibrium for Dhatu Lina correction, you can use Arogya Vardhani as a rasayana. So this is a protocol which you can be used, and you can derive success in this way. So what I mean is that if you don't relate it with the specific pathology which is persisting in the patient, if you are not identifying the correct pathology, then how will you select the proper medicine? So you should identify the proper pathology persisting in the patient, then you select the medicine accordingly. So the Kasisa is a wonderful drug, and you can make use in a wide range of applications. With the Nimbu Sarasa, it can increase the HP level within 2 or 3 weeks by 21 days. If you give Kasisabasma, I have a patient 3 weeks before having HP of 3. Now the patient has the HP of 9.5. So very quickly you can increase the HP level of the patient. So that's the best one. And you should be able to correct the HB level of the patient. Otherwise, the patient won't respond to your treatment. This is a part of his bala. Raktadhadu, the karma of Raktadhadu is jivana. The karma of Rasadhadu is nourishing. But the Raktadhadu, if the Raktadhadu is proper, then your treatment will work. So for improving the HB of the patient, it's very important. Most of the patients, even in cancer patients too, and many of the cases, the HB level you have to rise to get good results. And the best one is the Kasisabas. And the Anupana, you can select Nimbu Sarasa for increasing the HP. With Madhu, you can be Anupana. it is Yogavahi. With Vashasarasa, we have given in that Rakta type of disorders, and in liver pathologies you can use. And with Tengin Pokula Rasam, it is useful in Pradara. It can be used in Pradara. So the property of causes is Rakta Sanjaranam Param. With Rakta Sanjananam Param and Rakta Pittagnam. These are the property. In the many of the cases with the bleeding, which we have discussed earlier, local application is also important. When the bleeding is from nostril, you can use a Pradimarsha of Durvasarasa, which you will have excellent result. You use a Pradimarsha with Durvasarasa, best result for epistaxis. And for you can use the gum bleeding, you can use Gairiga. You can apply Gairiga there, it will stop. It's having guaranteed result. Gairiga is Rekta Pittatnam. Swadu Snigdha Himam Netram Kashayam Rekta Pittatnam. So it having good results in patients. So in Tengupukula Rasayana acts in another direction. So it is a control, both it arrests the bleeding, uterine bleeding. It can be having that action. But many of the patients, if they are having uterine bleeding, causes increases the bleeding. That's another thing. So you should be very cautious while using in patients with uterine bleeding. That's what we have found in patients, observed in patients. Then Naligera Jala is another use with the Suryaksharam. You can have a formulation. You can have in your clinic, you can make a simple formulation with the Suryakshara and the Kasisa. Suryakshara and the half part of Kasisa, you have to powder it and melt it, and within 2 or 3 hours of boiling it, you can turn it into red basma by simply heating it, by crystallizing, and then you can powder it well. A red brownish powder you get. By 100 milligram you can use it, and that Sudekshara Kasisa. Sudekshara has Pegana property, and as it has Pegana property, it will alleviate the urinary stones. So the Sudekshara Kasisa, when the Kasisa is combined with Suryakshara, and if you give it along with Naligera Jala or Naligera Gada, you can have best result in urinary stone. Or along with Bastyame and the Vrida you can give. That is the best one working in the urinary tract. Then when the Kasisa is processed with the Karaskara Balamajja, it has a result, very good result in Sutra. So you can have a treatment for hypopigmentation with Kasisa. But it is very good when it is processed with the Karaskara Balamajja. You grind it well with Karaskara Majja and have a puda of that. Then if you use that Basma, that will be very specifically ideal for Sutra. And the last combination is with the Kumari and Churnodara. That is a combination, that is a solvent which consists of Kumari Sarasa and Churnodara in the ratio 16:1. You have to prepare that solution in a bottle, keep it for 3 days, then you grind the Kasisa and make Chakurigas, and then make a puda of that. Then you can use it for Jara. This best working in Jara. Within 20 minutes or 30 minutes, if you check your patient with a thermometer, the temperature will be subsided. So how to apply all this is Sutrasthanardhasaram Suvimalamadiyil Sukshmamai Sangrahichum Matra Kala Tridosha Stududa Nilayum Sadmyum Nallavannam Netratal Kandaranyum Sutram Noki Prayogikum Sutram Noki Prayogichidum Alavi Lavan Keli Neela Parakum. This is from Sindhura Manjari, which is a traditional Rasa Shastra Grantha in Malayalam. So it is available in our library also. So this is what is said in that. So one commentator has explained that you don't have to look at the dosha, you don't have to look at the dhatu if you apply rasa oushadi. But that's not the truth. You need to apply with clinical precision. Then only you will get good results. That's the point which I want to make it clear. So these are the unique properties. Salpa himatra vibula gunascha sadyohi dipana pajanamcha. So this sadyo dipana and sadyo pachana, that is what is needed. In most of the disease, the inflammation is there, and these are the properties which needed. And why we use Vettumaran Guluga, even if the patient is in Amavastha and it is working well, is that it is Sadhyo Dipana and Sadhyo Pachana. So Rasaprayogamillatta Vaidyan Nannalla Kevala. This also a treatise in Malayalam which is called Chikilsaka Chintamani. It is also available in our library, and it is there. Rasaprayogamillatta Vaidyan Nannalla Kevalam means that many of the times if we don't know the use of rasa oushadi, many of the times we are not able to provide the required for the patient, and you may have to refer the patient to allopathic or modern system. But if we have the knowledge of rasa oushadis, we can have much more. We can provide much more to the patients. So some important drugs, others drugs which we can illustrate is loha basma, very important loha basma, is for curing fecal diseases. Murdani lohani vasi bhavanti, nignandi uttani mahamayamsa, abhyasa yoga dhrida deha siddhim, kurvandi rujjanna dharavina. So it is for attaining, they have rasayana property, and you can see the metallic basmas. The specific use which I can tell you, there are a lot of use for it, but specific use which I can convey is that Swarna Basma is the best one for brain degenerations. For degeneration, Swarna Basma is the best one. So, but the cost of the Swarna Basma is alarming. Many of the patients can't afford that. So, instead of Swarna Basma, for brain degenerations as well as other degenerations, you can opt. There is another choice which you have already studied, Abhragavasma, which is cost effective. So for degenerations of the brain, you can use Sarnabhasma, but if the patient can't afford, you can give them another choice is there, that is Abhragavasma. Abhragavasma 100 milligram is enough, but Sarnabhasma 50 milligram is enough. So if the patient is not there, so why I have selected Abraga instead of Swarna is that many of the patients can't afford that. That's why. So Gauri Teja Paramam Amrdam Vada Pitta Kshetnam Prakya Bodhim Prasamidarujam Vrishyam Ayushyam Agiran. So that are the properties of Abraga. So we can make use of that properties and can be made used in patient with degenerative disorders of brain. So you should ensure the quality of Abragavasma. So you should test the Tasma Pariksha, and the cardinal Tasma Pariksha is Nischandratvam. So you have to take a pinch of Abraga, you have to make it sure that there is no luster in the Tasma. So if you are purchasing the Tasma, you can't make Abragavasma. It is a long process. So as a general practitioner, you are able to buy Abhragavasma, but the thing is that you should verify its genuineness. The best test, practical test for making sure its genuineness is Nischandratva. There should not be any luster in the Basma. So if you give that Basma in 50 milligram or 100 milligrams per day, it is enough. And it is safe, you can use. So you can use this rasa oushadi in the degenerative disorders. So Raupya Basma, again it is Rasayana. Raupya Basma is again Rasayana, and it is again Brahmana like Sarna Basma. But what makes Raupya Bhasma, Rajata Bhasma different is that it is more Shrodoshodana. It is having a Legana property other than Brahmana. So, for Shrodoshodana purpose, even if it is a Rasayana, it is having a Shrodoshodana property. So, it can be used in infertilities which comes under Shrodoshodana. If the patient needs Shrodoshodana, your choice should be Raupya Bhasma rather than Swarna Bhasma. So the Loha Bhasma, another important Bhasma, which you can see invariably it is associated with the fat metabolism, the derangements in the fat metabolism. For any pathology having derangement in the fat metabolism, the best choice is Loha Bhasma. Along with that, you can use there is another option for those. It is Shiva Guliga, another one, which is advised to Lord Ganapati by Shiva. So, what's the importance, relevance of Shiva Guliga? It is the best choice for a person with metabolic disorder, having high risk of cardiac risk. So, that in order to avoid that, for protection, of heart, for the protection of kidneys, Vasti Jeshu Girijam. The Advira Aushada of Vasti Roga is Kannada, Shilajit. And the major content of Shiva Guliga is nothing other than Kannada or Shilajit. So the Shiva Guliga is the best choice which you can use in those metabolic disorders, including obesity. Like Lord Ganapati, he is having no exercise, sitting in front of sheets and eating it. So the best thing for that lifestyle disorder management, the best resource to be used is Shiva Guliga. Along with that, the Loha Bhasma is having importance and relevance since it is able to correct the derangement in the fat metabolism. Then we have already discussed about Abraga Bhasma. Its dosha samartham is Vada Pitta Samana without vitiating Kapha. So another thing is that in dry cough, you can choose Abraga Bhasma, very good result. Along with Pravala Bhasma, and you can use Abraga Bhasma. In most of the post-COVID symptoms, the patient with a lot of phlegm and chest infection, the best thing to use is a combination of Abraga Bhasma and Pravala Bhasma and Siddha Magardaja. To take 100 milligram of Pravala Bhasma, 50 milligram of Abraga Bhasma, and add 50 milligram of Siddha Magardaja. You give it once in a day. The best result, the best rasana for solve the issues. And COVID condition, not only in the post-COVID, even in the infectious period also, you can use it. And Abraga and Kanda will improve the oxygen saturation of the patient. And you can see that this Abraga is very much Belia and Rasayana. And it can stimulate the brain. And the diseases like Parkinson's and MND, motor neuron disease, all these, it is not completely curable. The disease is not sadhya, it is only yapya. But we can improve the quality of the patient, the standard of living of the patient by recommending this Abraga Bhasma along with Brahmi Grida. And along with the Medhe Rasayana, you can use this Abraga Bhasma. Along with Mahakalyanaka Grida, if you use Abraga Bhasma, the dose may be 50 milligram to 100 milligram. You can use in patients with mental problems, psychosis, including depression. They have good result in depression and anxiety. So along with Mahakalyanaka Grida, you can use it as a supportive therapy for the patient with depression and this insomnia, and also in anxiety, patients with anxiety. These are the next, one of the major drug which we can discuss is Gandhaga. For a general practitioner, it is very important since it is Adhirasayana. You can see the properties here. Deepta Anala Pajana, Gandhasma Adhirasayana, Sumaduraha Page, Kadu Ushnomada, Amon Mojana Shoshana Vishahara. So Amon Mojana and Ama Shoshana. So it is the best thing to restore the liver function, the best medicine to restore the skin health. So why is it acting in health skin disorders? Kandu, Kushta, Visarpa, Beddu, Dalana, Deepta, Anala, Pajana. So it is highly Deepana and Pajana, and also Amon, Mojana, Amashoshana. So it clears the Rasadhadu properly. So if the Rasadhadu is properly maintained, your skin will be recovered to the will be recovered back to normal. So the pathology of the skin is not skin deep, it is in fact deep up to Rasadhadu and Raktadhadu, and the Gandhaga is the choice for you to use in those patients having those conditions. So it will also stabilize the functions of the liver. So there are a lot of applications of Gandhaga Bhasma. You can apply along with Shira and Grida, as it the Sodhana Dravya is also that. So if we use along with that as Anubhana, you doesn't have any hypersensitivity. Even our Sodhita Gandhaga, even some patients with a sulfur drug allergy, I have given to them, and our Sodhita Gandhaga Bhasma doesn't produce any hypersensitivity. That was the observation. But you should be very cautious while giving it into patients with allergy. Even curcumin can be allergic to anybody, hypersensitive to anybody. So you should observe the patient. That's all. So it can be given with Nagara and the Tadbula as if for a Ajirna. In Ajirna, it can be useful in that mode. Then Guruji Sattva, along with Guruji Sattva, you combine Gandhaga. Gandhaga can be given in a dose of 200 milligram to 1 gram. But most of the time, we can select a less uh, matra. 200 milligram enough. It is enough. No need to go to 1 gram. Practically, it is a practical dose. You can select 100 milligram or 200 milligram of Gandhaga. And most of the time, Gandhaga Bhasma, which is available, is Avartida Sodhita Gandhaga. We are not incinerating it. Avartida Sodhita, like 21 times, 100 times Sodhita is being powdered and given as Gandhaga Bhasma. And it is enough in patient. And if you combine it with Tribala and Bringaraja Swarasa, that Gandhaga Rasa, Gandhaga with Tribala and Bringaraja Swarasa, is very useful for eye disorders to increase the vision. It is very useful. Then Gandhaga Rasayan is a combination which has Bhavana in Tribala, Trimada, Guruji and Shira, and it's very useful in almost all skin disease, including Vijarchiga, including the if the Kapha and Kleda is also there, it can be cured. So it's very useful in that condition. But proper diet restriction is also needed. You should avoid spicy things, that amla, chara, and this all those with pickles, the bread items, the masha, curd, all these should be avoided in that patient. Then only you will get the results. Then there is an external application with Gandhaga that is called Gandhaga Malahara, and that's very useful as an external. Many of the times when you apply oil to the patient, you can observe that it flares up. So we can avoid that flaring up by applying the malharas. And the Dandaka malhara is one such which is very useful. Then what is written in the last one is Navanidajam. Navanidajam means it is a preparation which we can make in your clinic. If you purify the Dandaka, the remnant milk has some debris of Dandaka, and you make it to a curd, and then you make it the Navanida out of that. And if it is applied externally, even it is very specific in Vedadika, and it is cured by 2 or 3 times application, it will be cured. So you can see the dosha shamanatvam. Abhraga is vada pitta shamana. Loha, you can see it is pitta sleshma shamana. Tamra, it is kaba pitta shamana. Tamra, which we haven't discussed earlier. Tamra is another metallic bhasma which can be used to reduce the hypertrophies, to reduce the tumors. It is very important. To reduce the tumor size, Tamra bhasma is having great role. It is highly lekhana. But Tamra should be very careful. Bhasma more than 20 milligrams. That's mana is required. Less dose is required. Less, be careful. Tamara is the most drug which a complication can happen if you don't care it. So the dose, you should be very careful. Don't use it more than 20 milligrams. But it's very useful for reducing the tumor size. Even in PCOS, we can combine many of the drugs like Nityananda Rasa and the Tamra of 10 milligrams. 100 milligram Nityananda Rasa, you combine 10 milligram of Tamra. So it is highly lekhana. So you can select in those pathologies which you need lekhana from. This should be dried up. The tumor will be dried up, and it's very having VEEKSHA guna and lekhana and tina. So you use it 10 milligram or 20 milligram. So then another one, Asisa, it is Pittasamana. Kanda is Vadasamana. Kanda increases the oxygenation in your body, Kanda Basma. And it can be also used in uterine bleeding along with Pravara Basma. Along with the Vasha Druga, you can use it. Then this Kanmada, Kangana, all those are Kabashamana. And these are some cases I'm not presenting here. I have these reports with me, the documents are with me, having good results, excellent result. I have kept those results with me. If anybody is interested, we can discuss later. So other basmas which you can use, Shanga basma, the best one you can use. It is very specific in Amla Pitta. So in acid peptic disorders, the best choice for you is Shanga Basma along with honey. In the empty stomach, 200 milligram of Shanga Basma we use, the patient will be very much relieved. So it is not only a calcium supplement. You can see it is not a calcium supplement. It is much more than that. So it pacifies and it gives an equilibrium for the enzymes which is acting in your digestive system. So it is Pitta Shamana. So in that manner you apply Shangabhasma, you will get good results. Another formulation which is very useful along with Shangabhasma in acid peptic disorders is Kamadugha Rasa. It's very much good, and Vairika is a major thing, and Leghu Sudha Shekhar Rasa is also having that property and very useful, and it's very cost effective and cheap medicine, but very much good for these acid peptic disorders and GERD. It's very good. then these are not mere supplements. They correct the metabolic pathways, and you can use it accordingly in the different conditions. And the first one you can see the Shilasat Dasma. Shilasat Dasma is called Kannada Dasma. In most of the pharmacies, they give Kannada Dasma. This Shilasat Dasma, that is Karpura Shilajat. So, this is very useful in the urinary tract infections. Very useful. Along with the Naligar, the guy, you give this Shilasat Basma in a dose of 200 milligram. This is very useful. Likewise, another important thing which is useful in urinary infection is Sweda Parpadi, which has Surakshara 16 parts, 2 parts this Tangana or Spadiga, and 1 part Navasara. And it can be given in a dose of 1 gram to even up to 2 gram. The stone, it is having Vedana property, and the stone gets cracked and it will comes out in the urine. Your patient comes with the stone which is expelled out. Some of the patient, they pick up the stone which are expelled. So you can use a combination of this Shweda Parpadi along with the Kannada Basma, along with proper anupranas like Chiruvilladi or Brihatyadi. So what I mean is that these are not, the processor is not a supplement for iron, Shanga is not a supplement for calcium, it is much more than that. We should use it judiciously by making use of its property which is explained in our Shastra and by judging the condition of the patient. So some of the pushtis, Pravala pushti is excellent for this duodenal ulcer and gastric ulcer. And many of the malaharas, Devika malahara is a very simple one, which you can prepare in a clinic or home with the base of Sitta Kaila and Devika and Haridra. It's a very simple one to prepare in your home. And the reference is Rasatarangani. And when you apply that Devika malahara to the patient, most of the time, in most of the skin lesions, it is working. So the application of the surgical sites where it can be used in degenerative diseases, even in genetic disorders, in cancer treatment, emergency management, and minimizing surgeries. So this is a very emergency one. When a patient comes to you with an acute respiratory distress, what will you do? You can't advise the patient as it is amasya bhavam and it will be subsiding due course. The patient is gasping in front of you. So in that instance, you can have choices of rasa oushadi. One is rasa gudara rasa. You can use in those acute condition of respiratory distress in which a patient is gasping for breath. So, Kasa Shwasa Samandagno Vadas Leshmameshu Cha Sannipade Murchayam Abasmare Tadapuna Adimohattam Abane Nasyam Dadyad Vidakshana Rasa Shwasa Gudharayam Sarva Shwasa Vikara. So, in those patients, we can't advise the patient as it is Shama Shwabhava and it will gradually subside. The patient is gasping. In that instance, as an instant relief you can provide to the patient by using the formulation of Swasa Gudara Rasa. So it is an excellent drug, and by the use of 2 or 3 days you can withdraw the drug also. And you can also use as a Dhumapana, which contains this Swasa Gudara Rasa. You can make the patient inhale. So I have an experience of a patient having continuous cough. When I searched the history, the medicine history, all the drugs for Kasa and Swasa he has taken, but no result. But the patient, I have given him a Dhumapana with this containing Haridra and Manashila. It subsided within 5 minutes. The continuous cough subsided. Why? Is it magic? It's not magic, but it worked like that. It may work like this. because the continuous cough may be as a result of the spasm of the diaphragm, maybe. So when you give a Dhumapana with this spasm will be relieved, as it may stimulate the Dhumapana, can stimulate the vagus nerve, which will relieve the spasm of the diaphragm. So the problem is solved within 5 minutes. So it is not a magic. By virtue of the dimension of our blood, we can do many things. And one such instance is this. So all these respiratory distress in an acute form can be addressed with this Dhumapana or taking internally the Shwasagudar rasa of at a dose of 130 twice a day. And the Bharnyadi Kashaya can also be used as a Sahapana. So in Chardi, even the causes are very different. It is a very difficult to address. In many of the cases, the Chardi, once the brain gets stimulated, it's very difficult, not that much easy. But the best one for Chardi, we should give it much, and we should investigate about the cause of Chardi, but even if it should be controlled. So it is not that much easy, but it can be controlled by using this Mayura Piksha Basma in a dose of 30 milligram along with Amalagi Churna, along with honey. So, but when the center gets stimulated, it's very difficult, but this is one choice which you can have with you. And many of the cases it is working. And you can use the Rasa Sindhura and Laja Churna. And if the Chardi is of gastric origin, you can use Sudashega Rasa. And even in Kasa, you can differentiate. Dry cough. In dry cough, we have already discussed Abraga is the best one in dry cough. And the Tangana Basma and the honey can be applied as a local throat paint or gargle so that the inflammation will be subsided. For tonsillitis, laryngitis, pharyngitis, all those Spadiga Basma and the Panikurta Swarasa. That's very best. And the cough with fever, we have discussed the Surya Prabha or Kabha Kudara Rasa. And for productive cough, Kabha Kedu Rasa is the specific choice in the oushadi. And Shwasananda Liga in Padharishta and Rasa is another choice which is working, and all the sputum will be extracted out. And the Brahani is a best combination of Ashtakshari Guliga, which contains this Upavisha, Ashtakshari, Arogyavardhini Rasa, and the Kaidaryadi Kashaya. Along with that, Shanga Basma is a choice which will reduce the inflammation in the intestine. I have three or four documented cases of ulcerative colitis in which we can judge it or diagnose it as Grahani, and we can have this combination, and this combination is working in those patients with ulcerative colitis. In Abhisara, in diarrhea, severe diarrhea, this one is very important. The Sanjeevani Guliga is very much important in dysentery and diarrhea. And the Sedu Bandham Guliga is another choice along with that. And the Ashtakshari in Vilambuda Shaya is a specific one to get rid of the tendency. We have already discussed about the Amla Pitta, Hitsula, and it's another session. We will discuss it in another session. For cardiac care, the oushadis can be given, and these are the choices. Sringa Basma is basically specifically to reduce the chest pain, even the angina. The Pravala Basma and Vasadi Kashaya, it is more useful for the problems with the heart valves. Nagarjuna Abra Rasa is specific in the muscle strength of the heart. the strength of the muscles are less, you can use Nagarjuna rasa. And in Kalyanakshara, you can use in Srodho Shodhana. Shankavadi is another one. And the Hridayarnava rasa is the best choice in cardiac pathologies, having tamra as a major ingredient. And if there is block in the blood vessels, this is the best choice. Hridayarnava rasa. And 200 milligrams, 250 milligrams can be used. If the patient is suffering when the urine is rasa, which is called Kannada Basma, you can Basma along with this as a 300 milligram dose and Rasa Sindhura and Gokshura along with this is another choice. And Vada Rogas, you can use differential use of Vada Roga. Vada Gajankushan is especially for Pakvashveda Vada. It is specific for Pakvashveda Vada. Vada Gajankusha Rasa. And the Vada Vidvamsana Rasa is for almost all Vada Vyadhi, including the Ashidi Vadajan Dogan, Mahavada Vidis, Mahavada is the one. And the is having specificity in
Sir,
Samavada. Brihat Vada Jasa is very
sir,
much
there is slight
useful and
network
specific.
problem, sir.
Yeah, yeah. Are you hearing me?
Sir, could you repeat
Hello?
the last few sentences?
Can you hear me?
Yes, sir.
Yeah. This Vada Roga slide,
Sir,
isn't
now
it?
you're audible.
Yeah,
Could you
yeah, yeah.
repeat the last few
We're coming
sentences?
to the, yeah. Am I audible now? Am I audible now? Hello?
Yes,
Answer
Can
sir.
I?
audible.
Yeah. Okay. So the Vada Gajankusha Rasa is specific. What I'm telling you is that you should use with specificity. Even though these are all indicated in Vada Vyadhi, we can use it specifically by virtue of its ingredients and its mechanism of action. So Vada Gajankusha Rasa is very much specific in patients with Pakvasha Gata Vada. And Vada Vidvamsana Rasa is very much useful in all kinds of Vada Vyadhis. It is useful, especially for Mahavada Vyadhis like Pakshagata and Ardhita. This Mahavada Vidvamsana Rasa is more good. Then Vada Rakshasa Guliga, it is used in Samavada. If the Vada is having association with Samatya is there, then Vada Rakshasa Guliga is the best one. So you can treat the Brihat Vada, you can treat the Mahavada Vyadhis like Pakshagada and Ardhida by making use of Brihat Ramani. It contains gold, it is costly, it's little bit costly. One tablet contains more than 100 rupees, but it will be useful to revitalize the patient and also for bringing the blood to the patient. For Pakshagada and Apida, you can use Brihatada Chintamani. Even 50 milligram per day is a sufficient dose. Then Mahayagaraja Vilpuri, it also contains Basmas. The reference is Argadara Samhita and it is good for OA, osteoarthritis. And the Smriti Sagara Rasa is very much useful in Abasma. In Abasma patients, it is getting good results and the frequency of episodes is diminishing. And the Abharagavasma you can use in degenerations of brain like Parkinsonism and even in development and anomaly in children. You can use Abharagavasma in a less dose. For a child, you can use 1/10 of the adult dose. For Vidgaras, for Kamala, Illicit Basma and Mandi is very much specific. Even for correct fibrotic changes in the lung tissue, liver tissue, The Mandura is very specific. Mandura Basma is very specific. Along with Vasa, Guru, Chadi, Kashaya you can use. In cirrhosis, Annadevi and Arogya is useful, but you should be very careful while dealing with cirrhosis patient. It is not easy. You should be patient, and even he may be affected with a coma stage. So be careful while dealing with that. And Shangabasma and Kumari Sarasa is also useful in many of the conditions. So the Prameha, you can see the Shivaviya is the best one, and the best for Prameha in patients which now I observe is the Trivanga Basma. The Trivanga Basma is having good, and if you compare Trivanga Basma with Abraga Basma, this is very much useful for chronic diabetic patients which have the destabilized values and the complications of diabetes like neuropathy, the muscle wasting, the sexual dysfunction, all will be improved with this. Then Amavadadi Rasa, with Eranda Kaila is a case, then Simhanada is there, then Tipari Jivara Kwada and Rasa Sindhura is very good, and Rekta, one of the major thing is very much useful formulation is there. It's Langalya Loha, which is the Udavisha, Langal is the Udavisha. So the toxicity studies were conducted for Tamra, Sasindura, and for Garbhakala Rasa, which contained Maga and Vanga. So in prescribed they are very much safe, but you should be very careful while sticking to the dose and regimens of the patient. So I'm not going through this, just the time is very much close to finishing that. These are rasayanas, and there is a concept of the Kshetrigaram. For rasayana purpose, you have to do Panchakarma before administering the rasaushadis, and the Panchakarmas for rasa chikitsa is that Pajanam Snehanam Sedo Vamanam Bhojanam Tata Edani Panchakarmani Nyadavyani Pushabure. And Vasti and Rakta Moksha you can't find here. Only Pajana, Snehana, Sweda, Vamana, Rejana. Which one is required? Do that alone, not all. And then the Sausadi, and you will get best result for Rasayana. And these are guidelines for the dosage. So you can stick these guidelines to age guidelines. So the seven were the and Niragni, Saganda and Nirganda. That's very important. The Rasa Oushadi is having Saganda processing. For example, Rasa Sindhura is very safe and you can use it. But Rasa Pushpa is not Saganda. It is not, the Rasa is not combined with Gandaga. So it is not safe. So you have to improve the dose by 3 or 4 times use. You should be able to study those identification. Please note that. So beware you are using Sanda formulations, and it will be steady and mirror is also important. Many of the practice used to give reservoir it is not so. So it is needed to be taken and used for long use of it, it is very useful.
Sir, your voice is breaking.
Curing the wound to prevent the infections in the wounds. This guidelines for the age. You can see 1 year. So 10 milligram only.
Your voice is breaking.
Major to 2 year, below 20 milligram, below 40 milligram, and up to 12 year, 6 year, half the tea, that is 16 tea. One, and these are the times some hypersensitivity, many of the sensitivity may arise even though. Hello, can you hear me? Am I hello?
You are
Sir,
audible,
voice
but your voice is breaking.
Hello?
In between
Sir, you're
voices,
audible,
Hello?
but your voice is breaking.
Hello? Hello? Hello?
yes,
Am I
sir.
audible?
But voice
Yes,
is
no problem. Yeah, we are coming. So can hello? 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 Are you able to hear me now? Hello?
Sir, your voice is still breaking, sir.
Yeah.
Could you try turning your video off?
Last slide.
Okay,
Uh,
okay, sir. Could you
the
try turning your video off?
okay, hello?
Yes, sir. Continue, sir.
Okay, okay. Yeah, yeah. Can you hear me? Hello?
Yes,
yes,
sir.
Can you hear me?
Yes,
yes,
sir.
sir.
Hello? Yeah,
Yes,
yeah,
sir, you
okay.
are
We are
audible.
coming to the slides. So, what the final slide, where if we use, hello, can you hear? Yeah, judging the condition by judgment of the patient, we can select apt medicine. A lot of drugs, thousands are around us. We should be able to pick up the right one according to the condition of the, and judging that you have to select the drug, rasa oushadi. And we have almost all, and the rasa oushadi is useful. Rationalization of the patient, rationally selecting an apt dosage for the patient. Duration of treatment is important. Dietary restrictions, and Anupana is very important. It's good and regular medication. So, in my presentation, we could not medicine equivalent to Rasasha. So, it can be developed as a nuclear medicine of Ayurveda, and the ancient wisdom of converting a poison to the most potent medicine requires a lot of self-discipline and perseverance. But the fact that it benefits the entire humanity is the inspiration behind such painstaking efforts and bowing our head with such great seers and including my thank you. Okay.
Hello, sir. Am I audible?
Yeah.
Sir, can we conclude, sir?
Definitely.
Hello, sir.
I think there is a lag in my connectivity. Lag. So we have
Yes.
ended almost covered all the portions and we can conclude.
Sir, could you repeat? You were not clear.
Yeah, we have covered all the slides. I have some lag in the connectivity. We can conclude the session. And if you have any doubts, you can ask the questions.
Yes, sir. Yes, sir. Sure. Thank you for such an innovative and brainstorming session, sir. Now we'll go on to the question answer session. I call upon Arundhati to ask all the questions asked.
Chart
The first question is what rasa oushadis can we give in increased iron level, especially in respiratory? So, did you get the question?
Yes, can you hear me? Can you hear me?
Yes,
Hello?
sir. Yes, sir.
Yes, sir.
Hello? Yeah, yeah. There is a connectivity issue, that's why I'm asking you. So this is a good question. And Abraga and the Pravada is a combination which will work in this condition. And definitely the condition can be improved. And the dose you can select maybe 100 milligram of Abragadasma and 200 milligram of this uh, Pravada and you can use this Dharmyadi Kashaya as a Sahapana. Have you heard? Is it audible?
Yes, sir.
Yes, sir. Yes, sir.
Okay, okay. So I can have another question I have seen in the chat box. Next question about the Somanabhiya Tamra Bhasma, which is
Yes, sir.
having a shining appearance. So actually the shining appearance is in the crystals. If you break it and powder it, then it will disappear. So it is virtue of the difference in the process. So if you grind it well and make it a powder, then the shining will disappear.
Thank you, sir. If anyone has
Yeah.
any other queries, they can ask in the chat box.
So even after powdering, the shining persists. It's because of the deviation in the Samanabhiya Tamarpasma process. So from where, which source you have collected? You have to check with that source. After grinding, it should not be there. The luster should not be there. Only one Bhasma have luster. One Sindura has luster even after the firing process. That is Swarnavanga. That's all. Swarnavanga will have luster after the firing process. All our Bhasmas and Sinduras are devoid of luster. Yeah, another question which I can see in the chat box is the Sahapana of the problem. The first question, the Sahabana I have said is the Dharmyadi Kashaya. Dharmyadi Kashaya, can use it as Sahapana.
Okay, sir.
Okay, okay.
So we have another question.
So another question I can see in the chat box is liver cirrhosis. About liver cirrhosis, what other medicines to follow? Only by judging the condition of the patient we could answer that. The condition is very much important. So the you should judge it only, then only we can say about that. Yeah, that's another good question. It is the combination of basma, should we reduce the dose of each basma, or we can give the safe dose of each basma? That's a good question. So you should reduce the dose of basma. That's needed. So accordingly, if you combine the basma, you should reduce the dose and combine it. That is needed. In full dose, you can't do that. Are you getting?
Yes, sir.
Is communications are clear? Are you clear in
Yes, sir.
understanding?
Very much.
Yeah.
So we have another question. What is the dose of Tangana that should be used for gargling in case of dry cough?
Can you repeat?
Sir, what is the dose of Tangana that should be used for gargling in case of dry cough along with Madhu?
Yeah. That dose is variable. It is only a local application. 2 gram of Tangana can be taken, and you can mix it with even honey, and you can have a throat paint of that. So when you apply that, the patient will be showing some irritation. But after 5 minutes, you can see that all his inflammation, all the saliva and all will drop down, and it will be cleared. His upper respiratory tract will be cleared.
Thank you, sir. We are coming to the end of the webinar. If there are any more questions, kindly ask as soon as possible.
So my advice is that you need to practice all this in your clinic, in your patient, then it will be fruitful. And am expecting all of you to practice all this and become good doctors. Wishing you all the best.
Thank you so much, sir. I now call upon Pallavi.
Hello.
Yes,
Hello, am I
Pallavi.
audible?
Yes, Pallavi.
Good. Okay. Good evening to one and all present here. It is such an honor for me to have the opportunity to thank you all dignitaries. On behalf of HSA 2021-22, I would like to express my gratitude to all esteemed delegates for their presence and contribution to make this webinar a great success. I extend my gratitude to our sir, Dr. Anand S, Associate Professor, Department of Rasashastra and Ayurveda, Government Ayurveda College, Ayurveda College, for taking out time from his busy schedule to grace the event. Thank you for inspiring and encouraging us with your extensive knowledge, sir. A special thanks to Dr. J. Nair, Principal, Government Ayurveda College, Trivandrum, for providing immense support to make the webinar happen. I must thank the organizing team of VEEKSHA Academic Series for their sincere effort in conducting sessions that will deepen our clinical knowledge. Thanking all the attendees of the meeting for their active participation. Thank you everyone once again for making the first session of VEEKSHA Academic Series a fruitful one. Thank you.
Thank you, and good night.
We thank you all wholeheartedly for the patient listening. Do follow our page on Facebook and Instagram to get alerted on our next session. Thank you once again. Good night.